Diabetes mellitus is one of the modern world's most dominant diseases. This condition later on leads to a menacing eye disease called diabetic retinopathy, which can eventually cause total blindness. Therefore, the main goal and aim of our system is to be able to automatically detect and classify the preliminary stage of diabetic retinopathy. So the first question that came to our minds was how serious diabetic retinopathy really is. According to the World Health Organization, around 422 million people worldwide have been diagnosed with diabetes mellitus. These cases were particularly in low and middle income countries, and the stated numbers are only expected to increase with time. And according to the American Diabetes Association, 1/3 of people suffering from diabetes are also expected to be diagnosed with eye diseases such as diabetic retinopathy, which means that around 147 million people are vulnerable. The following scene demonstrates and strongly depicts the world through the eyes of a normal person. A non-diseased person has the ability to easily perform his daily routines and enjoy his life. However, many others simply can't because of diabetic retinopathy. It feels different when you're a diabetic retinopathy patient. Life becomes tougher and much harder with each upcoming day, and the small details become more vague and ambiguous. Going through the simulation, we were somehow able to convey and picture the world through the eyes of a diabetic retinopathy patient. So now we're going to discuss the main problems that we're going to face concerning the treatment of diabetic retinopathy. The first critical problem would have to be the disease detection process, since diabetic retinopathy is one of the hardest diseases to detect at its early stages. The next problem would be the stage classification process, because it's very important to differentiate between the distinct stages of the disease and be able to provide the most suitable treatment. According to articles and papers concerning this specific topic, the disease classification accuracy is another major and extreme problem that we might face. The final, and some might consider the most critical issue, is the reliability of the results, which plays a paramount role in the whole treatment process.
And here came the idea of our system, an automatic classification of diabetic retinopathy. Depending on the main problems of the current situation, our project scope was decided. Obviously, detecting DR had the highest priority due to its significant importance, especially in the early stages. Classifying the stages of the disease within an acceptable range of accuracies is no doubt the first and most important step in the process of treatment. This whole system is carefully designed and implemented to act as a doctor assistant. This will help us get the best possible results. But is such a system applicable to be implemented on real life? First of all, our feasibility study was made upon a sufficient market research to be sure that the market is really in need for such a system and to be clear about the weakness points of the current available solutions. Actually, many doctors were against applying similar systems due to the lack of reliability in their outputs, unclear or non-friendly user interfaces, which was a difficulty for many of the system's users, or that the system required a high running cost, which might not be affordable in some cases. Therefore, our plans to overcome these drawbacks included using large fundus images datasets in training our systems models, design a user-friendly interface according to the HCI guidelines, in addition to minimizing the needed running cost to the least possible. It seems that the proposed system might be applicable, but is the market really in need for this system? Actually, this system is expected to have both an industrial and social impacts when applied. Socially, the number of DR patients led to blindness will gradually start decreasing, and this will help in raising the people's awareness about this disease. On the industry side, the success of this system will encourage many others to design similar systems or come up with more innovative ideas that will ease the process of diagnosing and treating different diseases. And this is what the market is really in need of right now.
So, what we accomplished until now is: first, our proposed system achieved an accuracy of 75% for detecting the presence of the disease, and 63% for classifying its stage. Secondly, our proposed system is a cascaded architecture, which consists of two models, and that will be discussed later in details. And finally, the system allows the doctor to suggest a stage if the stage classified by the system was incorrect, and then retrain the architecture. Our proposed system is a cascaded architecture, which consists of two models. The first one is a VGG16 model, which classifies the input image, whether it suffers from DR or not. If yes, then the image will be moved to the next layer, which is also a VGG16 model to classify the stage of the DR.
Going through our system overview, which is starting with uploading the images to our system, the system passed through different stages. First, pre-processing, where we normalize all the images to be all equal sized. Then the main process stage takes place, where we classify the input data and train the system. Finally, the last stage, which is the result stage, where the doctor views the result containing if the patient has diabetic retinopathy or not. If yes, the system views which stage the patient is in. According to our system overview, in our block diagram we divided our system into 6 modules. First, login and sign up module, where each user log into his own portal. Then data acquisition module, by taking images from each source and upload it into our system. Then data manipulation module, where we normalize the images. Then detection and classification module, where we use our classification model to classify the patient stage. Then the report and summary module, where the system generates a detailed report after uploading the both left and right eye images. At last, the user interaction module, which contains all user function as viewing report, create, read, update, or delete. The architecture of our system contains 4 layers. The first layer is the view layer, which contains the web interface for all users. Then the second layer is the controller layer, which contains all user controller and the pre-processing and classification controller. The third layer is the model layer, which contains the libraries and the algorithm and the core function that we use to create our model. The fourth and the last layer is the database layer. Our system cycle starts with taking an input image from the patient. Then the system starts classifying the input image and recognize its stage. The doctor will provide his feedback on the system results. Finally, the system will use the image and the doctor feedback to retrain itself and improve its classification accuracy by time. In this demo, we'll show you how each user will interact with our system. First, starting with the admin, after login, he can view all the users and control all the users by adding or deleting any user. Then, the doctor, after login, can view all the patients and select his patient from the list. Then the doctor upload the fundus image of the patient by choosing the left and the right image. Then click on classify. Then our system generate the report that the doctor can view or print it as a PDF. This report is containing a detailed description for each eye of the patient. Finally, the patient can log into his own portal and view all his previous checks with the doctor and view its report and print it. In order to develop this web-based system, we used several software platforms, mainly HTML, PHP, and CSS, to develop and design the user theme part of our system, which is a website interface, while Python was used in implementing the core system functions that are related to detection and classification.
The following Gantt chart represents a detailed schedule or time plan in which we clearly show our current progress and future work. The time plan is divided into 4 main categories, in which each category is further divided into activities, and the time slots are colored according to the corresponding activity. The first category would be gathering data and analysis, which consists of researching and analyzing diabetic retinopathy, discussions with stakeholders, gathering requirements, documenting current systems, deciding team roles and responsibilities, and finally proposing the final system idea. These activities are expected to take up to 3 months from July of 2019 up until September of 2019. The second category, which started right after the first one, is called the System Design category, and it consists of the functional and non-functional requirements, the software general description, interface requirements, database design, operational scenarios, conducting the software requirement specification document, designing the system architecture, designing the components, designing the human interface, conducting the requirements matrix, and finally conducting the software design document. These activities are expected to take up to 6 months from October of 2019 up until March of 2020. The third category started concurrently with the second category, and it's called the System Development category. It consists of developing system modules, integrating the system modules, preliminary system testing, and producing the final ready software. And this specific category is expected to take up to 9 months from October of 2019 up until May of 2020. The fourth and final category is called the System Testing category, and it consists of testing the overall system performance and accuracy, documenting any issues found, and resolving these issues. And this category is expected to take up to only 1 month, which is June of 2020. So in conclusion, the main goal of the proposed system is to be able to thoroughly enhance the detection of diabetic retinopathy, the applicability of the system based on market research, the system impacts the social and industrial aspects of life, innovative features are also used to solve critical problems and issues, and finally, we are still investing more time and effort as we believe there is still better, which leads us to planning the system's future work. So for the future work, we are planning to increase the used dataset to train the system's model, which will ultimately increase the system's overall accuracy. And finally, we're going to try new models which might be a huge factor in improving the system's performance.